51. What is the antidote for warfarin overdose? A. Vitamin K. B. Protamine sulfate.
C. Naloxone.
D. Flumazenol. Answer. A. Vitamin K. Rationale. Vitamin K reverses warfarin-induced bleeding. 52. Which medication should not be given with grapefruit juice? A. Atorvastatin. B. Furosemide. C. Levothyroxine. D. Metformin. Answer. A. Atorvastatin. Rationale. Grapefruit juice increases statin toxicity. 53. Which of the following is a key side effect of loop diuretics? A. Hypokalemia. B. Hyperkalemia. C. Hypertension. D. Hyperglycemia. Answer. A. Hypokalemia. Rationale. Loop diuretics increase potassium excretion. 54. Which drug is contraindicated in pregnancy due to teratogenic effects? A. Isotretinoin. B. Acetaminophen. C. Ranitidine. D. Loratadine. Answer. A. Isotretinoin. Rationale. Isotretinoin causes severe birth defects. 55. What is a major concern with prolonged proton pump inhibitor use? A. Osteoporosis. B. Hypokalemia. C. Hyperglycemia. D. Bradycardia. Answer. A. Osteoporosis. Rationale. PPIs decrease calcium absorption, increasing fracture risk. 56. Which drug is used to prevent ulcers in NSAID users? A. Misoprostol. B. Ranitidine. C. Omeprazole. D. Sucralfate. Answer. A. Misoprostol. Rationale. Misoprostol protects the stomach lining from NSAIDs. 57. Which antibiotic is associated with ototoxicity? A. Gentamicin. B. Amoxicillin. C. Azithromycin. D. Ceftriaxone. Answer. A. Gentamicin. Rationale. Aminoglycosides can damage the auditory nerve. 58. Which drug is a first-line treatment for absence seizures? A. Ethosuximide. B. Phenytoin. C. Valproate. D. Carbamazepine. Answer. A. Ethosuximide. Rationale. Ethosuximide is the primary treatment for absence seizures. 59. Which medication can cause severe flushing when taken with alcohol? A. Metronidazole. B. Azithromycin. C. Levofloxacin. D. Amoxicillin. Answer. A. Metronidazole. Rationale. Metronidazole causes a disulfiram-like reaction. 60. Which drug requires regular INR monitoring? A. Warfarin. B. Heparin. C. Enoxaparin. D. Clopidogrel. Answer. A. Warfarin. Rationale. Warfarin dosage is adjusted based on INR levels. 61. Which of the following is a major side effect of SSRIs? A. Sexual dysfunction. B. Hypotension. C. Weight loss. D. Tachycardia. Answer. A. Sexual dysfunction. Rationale. SSRIs commonly cause decreased libido. 62. Which medication can cause orange discoloration of body fluids? A. Rifampin. B. Metformin. C. Ciprofloxacin. D. Vancomycin. Answer. A. Rifampin. Rationale. Rifampin can turn urine, sweat, and tears orange. 63. Which antihypertensive drug is safe in pregnancy? A. Labetalol. B. Lisinopril. C. Losartan. D. Spironolactone. Answer. A. Labetalol. Rationale. Labetalol is a first-line drug for hypertension in pregnancy. 64. Which medication should not be combined with MALIs due to hypertensive crisis risk? A. Tyramine-containing foods. B. NSAIDs. C. Benzodiazepines. D. Opioids. Answer. A. Tyramine-containing foods. Rationale. MALIs plus tyramine cause dangerous hypertension. 65. Which medication is used for acute alcohol withdrawal? A. Lorazepam. B. Haloperidol. C. Naloxone. D. Phenytoin. Answer. A. Lorazepam. Rationale. Benzodiazepines prevent alcohol withdrawal seizures. 66. Which of the following medications can cause life-threatening angioedema? A. Lisinopril. B. Metoprolol. C. Furosemide. D. Atorvastatin. Answer: A. Lisinopril. Rationale: ACE inhibitors like lisinopril can cause severe angioedema. 67. A patient taking digoxin should be monitored for which electrolyte imbalance? A. Hypokalemia. B. Hypernatremia. C. Hypocalcemia. D. Hypermagnesemia. Answer: A. Hypokalemia. Rationale: low potassium increases digoxin toxicity risk. 68. Which drug is known to cause red man syndrome when infused too rapidly? A. Vancomycin. B. Ampicillin. C. Ceftriaxone. D. Metronidazole. Answer: A. Vancomycin. Rationale: rapid vancomycin infusion releases histamine, causing flushing. 69. What is a major side effect of corticosteroids with long-term use? A. Osteoporosis. B. Hyperkalemia. C. Hypoglycemia. D. Weight loss. Answer: A. Osteoporosis. Rationale: corticosteroids decrease bone density, increasing fracture risk. 70. Which of the following drugs requires therapeutic drug monitoring to prevent toxicity? A. Phenytoin. B. Citalopram. C. Amlodipine. D. Hydrochlorothiazide. Answer: A. Phenytoin. Rationale: phenytoin has a narrow therapeutic range and requires monitoring. 71. Which medication can cause peripheral neuropathy as a side effect? A. Isoniazid. B. Acetaminophen. C. Ranitidine. D. Aspirin. Answer: A. Isoniazid. Rationale: isoniazid depletes vitamin B6, leading to neuropathy. 72. Which class of drugs is most likely to cause serotonin syndrome when combined with SSRIs? A. MAOIs. B. Beta blockers. C. Antacids. D. NSAIDs. Answer: A. MAOIs. Rationale: MAOIs plus SSRIs increase serotonin levels dangerously. 73. Which medication is used as an antidote for opioid overdose? A. Naloxone. B. Flumazenol. C. Protamine sulfate. D. Atropine. Answer: A. Naloxone. Rationale: naloxone rapidly reverses opioid-induced respiratory depression. 74. Which antibiotic is known for causing tendon rupture? A. Ciprofloxacin. B. Amoxicillin. C. Doxycycline. D. Metronidazole. Answer: A. Ciprofloxacin. Rationale: fluoroquinolones increase tendon rupture risk. 75. What is a key nursing consideration when administering 4-potassium? A. Never give 4-push. B. Administer as a rapid bolus. C. Mix with normal saline only. D. Always give with dextrose. Answer: A. Never give 4-push. Rationale: 4-push potassium can cause fatal cardiac arrest. 76. Which medication can cause lactic acidosis in patients with renal impairment? A. Metformin. B. Insulin. C. Glipizide. D. Pioglitazone. Answer: A. Metformin. Rationale: metformin accumulates in renal impairment, leading to lactic acidosis. 77. Which drug class should be avoided in asthma patients due to bronchospasm risk? A. Beta blockers. B. Calcium channel blockers. C. ACE inhibitors. D. Thiazide diuretics. Answer: A. Beta blockers. Rationale: beta blockers can worsen asthma by causing bronchoconstriction. 78. What is the recommended timing for taking levothyroxine? A. On an empty stomach in the morning. B. With meals. C. At bedtime. D. With calcium supplements. Answer: A. On an empty stomach in the morning. Rationale: food and supplements interfere with levothyroxine absorption. 79. Which drug is commonly used to treat bipolar disorder? A. Lithium. B. Sertraline. C. Risperidone.
D. Diazepam.
Answer: A. Lithium. Rationale: lithium stabilizes mood in bipolar disorder. 80. Which medication should be avoided in children due to Reye's syndrome risk? A. aspirin. B. Acetaminophen. C. Ibuprofen. D. Naproxen. Answer: A. Aspirin. Rationale: aspirin increases Reye's syndrome risk in children with viral infections. 81. Which anticoagulant is safe for pregnant women? A. Heparin. B. Warfarin. C. Rivaroxaban. D. Dabigatran. Answer: A. Heparin. Rationale: heparin does not cross the placenta and is safe in pregnancy. 82. Which medication is most commonly associated with first-dose hypotension? A. Prazosin.
B. Amlodipine.
C. Metformin. D. Omeprazole. Answer: A. Prazosin. Rationale: prazosin, an alpha blocker, can cause severe first-dose hypotension. 83. What is the primary concern with abrupt discontinuation of benzodiazepines? A. Seizures. B. Hypertension. C. Weight loss. D. Hypoglycemia. Answer: A. Seizures. Rationale: stopping benzodiazepines suddenly can trigger withdrawal seizures. 84. Which medication can cause hyperkalemia as a side effect? A. Spironolactone. B. Furosemide. C. Hydrochlorothiazide. D. Atenolol. Answer: A. Spironolactone. Rationale: spironolactone is a potassium-sparing diuretic. 85. Which antibiotic should be avoided in pregnancy due to risk of fetal tooth discoloration? A. Tetracycline. B. Penicillin. C. Cephalexin. D. Clindamycin. Answer: A. Tetracycline. Rationale: tetracyclines bind to calcium, causing permanent tooth discoloration in fetuses and children. 86. Which of the following medications is most commonly associated with ototoxicity? A. Gentamicin. B. Acetaminophen. C. Metoprolol. D. Atorvastatin. Answer: A. Gentamicin. Rationale: aminoglycosides like gentamicin can cause irreversible ototoxicity. 87. Which drug class requires patients to avoid foods high in tyramine? A. MAOIs. B. SSRIs. C. Beta blockers. D. Benzodiazepines. Answer: A. MAOIs. Rationale: tyramine-rich foods plus MAOIs can cause hypertensive crisis. 88. Which medication can cause gingival hyperplasia as a side effect? A. Phenytoin. B. Metformin. C. Warfarin. D. Clonidine. Answer: A. Phenytoin. Rationale: phenytoin can lead to overgrowth of gum tissue. 89. Which of the following drugs is known to cause orange discoloration of urine? A. Rifampin. B. Ciprofloxacin. C. Hydrochlorothiazide. D. Acetaminophen. Answer: A. Rifampin. Rationale: rifampin causes harmless orange-red discoloration of body fluids. 90. Which electrolyte abnormality is a major risk with furosemide therapy? A. Hypokalemia. B. Hypernatremia. C. Hypercalcemia. D. Hypermagnesemia. Answer: A. Hypokalemia. Rationale: loop diuretics like furosemide cause potassium loss. 91. Which medication increases the risk of Achilles tendon rupture? A. Levofloxacin. B. Amoxicillin. C. Metronidazole. D. Doxycycline. Answer: A. Levofloxacin. Rationale: fluoroquinolones weaken tendons, increasing rupture risk. 92. Which medication should be taken at night to lower cholesterol levels effectively? A. Atorvastatin. B. Lisinopril. C. Levothyroxine. D. Metformin. Answer: A. Atorvastatin. Rationale: cholesterol synthesis peaks at night, making statins more effective. 93. What is a primary side effect of nitrates like nitroglycerin? A. Headache. B. Hyperglycemia. C. Constipation. D. Bradycardia. Answer: A. Headache. Rationale: vasodilation from nitrates can cause headaches. 94. Which drug class is most likely to cause drug-induced lupus? A. Hydralazine. B. Beta blockers. C. Calcium channel blockers. D. ACE inhibitors. Answer: A. Hydralazine. Rationale: hydralazine and procainamide can trigger lupus-like syndromes. 95. Which of the following medications is contraindicated in pregnancy due to fetal bone growth suppression? A. Tetracycline. B. Amoxicillin. C. Azithromycin. D. Cephalexin. Answer: A. Tetracycline. Rationale: tetracyclines inhibit bone development and stain teeth. 96. Which drug can cause hyperkalemia by inhibiting aldosterone? A. Spironolactone. B. Hydrochlorothiazide. C. Furosemide. D. Metoprolol. Answer: A. Spironolactone. Rationale: potassium-sparing diuretics block aldosterone, leading to hyperkalemia. 97. Which medication is a high-risk drug for causing severe hypoglycemia in elderly patients? A. Glyburide. B. Metformin. C. Sitagliptin. D. Acarbose. Answer: A. Glyburide. Rationale: sulfonylureas like glyburide increase insulin secretion, causing hypoglycemia. 98. Which medication requires INR monitoring to prevent bleeding complications? A. Warfarin. B. Heparin. C. Rivaroxaban. D. Dabigatran. Answer: A. Warfarin. Rationale: warfarin's effect is monitored using INR to prevent over-anticoagulation. 99. What is the most concerning adverse effect of clozapine? A. Agranulocytosis. B. Tardive dyskinesia. C. Weight loss. D. Hypertension. Answer: A. Agranulocytosis. Rationale: clozapine suppresses white blood cells, increasing infection risk. 100. Which over-the-counter medication should be avoided with warfarin due to bleeding risk? A. Aspirin. B. Acetaminophen. C. Diphenhydramine. D. Ranitidine. Answer: A. Aspirin. Rationale: aspirin plus warfarin increases bleeding risk.